Namaste everyone, this is Dr. Fairy Salecha and thank you for coming down to my channel. Let's talk about matured eggs and immature eggs when we talk about IVF. Let's just crack down the journey of an egg. We call it as oocytes also in IVF. So from M1 to M2 transition. In the world of IVF, timing is very important, dear friends. When your eggs are retrieved, they aren't all the time at the same stage of development. So when I say development is the immature form and the matured form. We look for the golden standard of maturity, of course, when we talk about IVF. Now, the M1 stage, which is called as intermediate stage as well, or the metaphase 1 of an egg, is an immature stage. It's an immature egg at that level. It has just begun the process of cell division but hasn't yet reached the point where it can be successfully fertilized. So now you get my point. Think of it as a cake that still is in the oven. It looks like a cake, but it is not ready to be served. Very similar to that. Now, the transition. What happens? It's also called as IVM. Okay, maturing in the lab, sometimes these eggs retrieved as M1s can compete their maturation in the laboratory incubator for few hours or maybe 24 hours. This process is called as IVM, which is called as in vitro maturation of these eggs. Now comes the M2 stage, very crucial, very important. That's called the matured state. Now, an M2 or metaphase 2 stage of oocyte is a fully matured egg, ready for ICSI, ready for fertilization, probably if it's a good quality. Now, how you can identify this? There's a presence of polar body, a small package containing half of the egg's chromosome. This signifies that the egg is ready to accept a sperm and move towards fertilization. So now drops in the role of ICSI, that's intracytoplasmic sperm injection that we embryologists do. This is a specialized form of fertilization using a micromanipulator to give the sperm a helping hand, of course. While we can perform ICSI on eggs that are matured from M1 to M2 in the lab, these are called as late bloomers, have generally slightly lower fertilization rate and pregnancy rate compared to the eggs that are already M2 at the time of retrieval or pickup. Should you have any other queries, please consult us today at Androplus. We'll be more happy to help you and let you know what your gametes are, what the quality is, how they are, how the gametes work in IVF and XYZ, all the queries that you have in your head. Signing off, Dr. Fairy Salecha. Namaste.